Hello friends, myself Imran. I'm an intern in Government Medical College. So today we are going to discuss about the anatomy of mediastinum. Starting with the basics. What is mediastinum? Mediastinum is basically the space between the lungs. So it is the middle space left in the thoracic cavity in between the lungs. The mediastinum is divided into two, superior and inferior mediastinum. As you can clearly see in this image, we have superior mediastinum and inferior mediastinum. The superior and inferior mediastinum is divided by an imaginary line. The inferior mediastinum is further divided into anterior, middle and posterior. As you can see in this image, this basically is heart. Heart is the main content of the middle mediastinum, and anterior of middle mediastinum we have anterior mediastinum, and this is basically the middle mediastinum, and the last one, posterior of heart, we have the posterior mediastinum. Now coming to the superior mediastinum. What are the boundaries of the superior mediastinum? Anteriorly we have the sternum, and posteriorly we have T1 to T4 vertebral column. Superiorly we have the thoracic inlet, and inferiorly there is an imaginary line present from sternal angle to the T4. Imaginary line from sternal angle to T4. These are the boundaries of superior mediastinum. Now coming to the contents of superior mediastinum. So basically we have to have a image memory of this image. So there are two contents that are not present in this image. One is the thymus and the second one is the thoracic duct. We have to memorize that there is thymus and thoracic duct. Thoracic duct would come again in posterior mediastinum. And what are the other contents present in superior mediastinum? Right and left brachiocephalic vein. Right brachiocephalic vein and left brachiocephalic vein. And the other content is arch of aorta and its branches. As you can see, this is clearly the arch of aorta and its branches, brachiocephalic artery, left common carotid artery and left subclavian artery. And the nerves, what are the nerves that are present in the superior mediastinum? We have the phrenic and vagus nerve and left recurrent laryngeal nerve. There is no right recurrent laryngeal nerve as a content of superior mediastinum. And we have trachea and esophagus. If we have a basic idea of this image, we can clearly write all the contents of superior mediastinum, and not so important nodes, paratracheal, brachiocephalic and tracheobronchial nodes are present in the superior mediastinum. The most important one is thoracic duct, as it is the largest lymphatic vessel. Now coming to the inferior mediastinum. Inferior mediastinum, we have anterior mediastinum, middle mediastinum and posterior mediastinum. In anterior mediastinum, what are the contents of anterior mediastinum? The contents that are present anterior to the heart. We have thymus gland again. Thymus gland is also present as a content in superior mediastinum. Sternopericardial ligament. It is a ligament which connects sternum and pericardium, and pericardium is a content of middle mediastinum which comes in the middle mediastinum. And we also have mediastinal branches of internal thoracic artery. There are only three contents that we have to remember. First is thymus gland, second one is sternopericardial ligament, and third one is the mediastinal branches of internal thoracic artery. Now coming to the middle mediastinum. Middle mediastinum, we already know what are the major content. First one is the pericardium and the heart. As we can clearly see, the heart and pericardium. Now coming to the second content, that is ascending aorta. Ascending aorta, as you can clearly see in this image, ascending aorta, pulmonary trunk and lower half of superior vena cava. As you can clearly see in this image, we can see the lower half of superior vena cava, right and left pulmonary veins. This is left pulmonary vein, right pulmonary vein, right and left phrenic nerve. And the most important one is the tracheal bifurcation. We have to remember the tracheal bifurcation is present as a content in middle mediastinum, divides into right and left principal bronchi. The main content is pericardium and heart, and other main content is tracheal bifurcation. All others are like ascending aorta, pulmonary trunk, lower half of superior vena cava, right and left pulmonary vein, right and left phrenic nerves. These are all the contents of middle mediastinum. Now coming to the last, that is the posterior mediastinum. What are the contents of posterior mediastinum? In this image we can clearly see the esophagus. Esophagus is also a content of superior mediastinum, and the other content that is also present in superior mediastinum is thoracic duct. The other contents like descending thoracic aorta. You can clearly see the descending thoracic aorta here. Descending thoracic aorta, and as we are seeing the content of posterior mediastinum, that are content that are present in the posterior aspect of the heart, we clearly know azygous, hemiazygous and accessory hemiazygous veins are present in the posterior aspect, and the nerves that are present is vagus nerve, splanchnic nerve and sympathetic chain, and lymph nodes like posterior mediastinal lymph nodes are present in the posterior mediastinum, and the main one is the thoracic duct, which is also present in the superior mediastinum. Thank you for watching. Hope you like the content that I am making. Make sure you hit the